organization representing Ontario home care providers says some 4,000 nurses have left the sector since the beginning of this pandemic. Home Care Ontario says before COVID-19, providers were able to fulfill care requests 95% of the time. As of last month, that number dropped to 56%. And the union representing 60,000 healthcare workers has been sounding the alarm over the weekend about severe hospital shortages, leading to more than just burnout among our frontline healthcare workers.
Headwaters Healthcare Centre in Orangeville has reportedly been relying on non-regulated employees to support patients by helping them with feedings or taking them to appointments within the hospital. To discuss the impact of not having enough nurses and trained staff in our hospitals right now, we welcome back to CP24 tonight President of SEIU Healthcare, Charlene Stewart, Ontario Nursing Association President Catherine Hoy, and infectious disease specialist with University Health Network, Dr. Abdu Sharkawi, who worked in the COVID unit all weekend and will be back at it again later tonight. Thank you all for making time for this discussion. Charlene, your union says kitchen staff at that Orangeville hospital were pulled from their jobs to help with staffing shortages. What unfolded over the weekend?
Well, like was reported, staff were asked to put their name forward to come in over the weekend because of the staffing shortages experienced by this hospital. And on Saturday morning, we got reports Friday evening from concerned nurses that dietary aides were asked to come and help them on the floors. And like they said, they appreciate the extra hands, but they need the right hands. And that again brought to the surface the systemic problem in this province that we have a health human resources crisis. And Orangeville was the story of the weekend, where the staff there are saying that they're asked to help out. They're being redeployed. They don't know what they're doing or where they're going until they get to the hospital and they're told what to do. And again, the message over the weekend was that the RPNs that spoke to me appreciate the help, but it was the wrong hands. What we need to do is address the nursing crisis in this province once and for all.
Okay, so you say you need the right hands. Dr. Sharkawi, I'm interested to get your perspective. If you can take us into the COVID unit, into the hospitals, how would you describe the state of healthcare and healthcare workers in Ontario tonight?
Well, I think at this point in time, this is something we're very used to. Unfortunately, it's a situation that demands a great deal of resilience, a great deal of reliance on one another to get ourselves through this. And that includes, having fantastic nurses who have really done superhuman work throughout this pandemic. But make no mistake about it, everybody is fatigued. Everybody at this point in time feels like they're really marshaling every last bit of strength and energy within themselves. And this is sort of unprecedented because now so many of us have either family members or people that are close to us who have been affected by COVID and by Omicron in particular, because it has spread so rampantly. So it's added an extra barrier and an extra layer of difficulty to looking after patients. It's also led to a lot greater breadth and depth of patients than we've ever seen before. We talk about for COVID or with COVID. At the end of the day, there's still a lot of patients that are sick enough, many of whom are tipped over in terms of their heart failure, their kidney issues, their delirium, some other problem that is unquestionably made worse by having been recently exposed and infected to COVID. So infected with COVID. So it's really an unprecedented challenge at this point in time. It's really not sustainable, and I'm somewhat hopeful that this is going to crest soon. The problem is you have to realize when you scale a very tall mountain, you get to the top, you may feel satisfied that the hardest part is done, but getting down a very steep slope is a very difficult thing, and that's what I'm concerned about over the next few weeks. In particular, we need to be absolutely vigilant about supporting our healthcare system and keeping people safe and keeping fewer people out of our ICUs, keeping them out of ICUs and keeping them out of hospital in general.
Dr. Sharkawi, is it feasible, though, the situation that we're in right now? A personal story that I was told, a 67-year-old woman, she lost mobility in her hands, advocated for herself because she was turned away in the ER. She eventually got surgery, but that night in the hospital, she wasn't fed, she didn't get help using the toilet, forced to go back to her bed soiled, exposed to COVID during an X-ray. She tested positive, and she told me that it's not care right now, it's abuse. This is sick-making, not well-making. So are we successfully tending to patients in hospitals right now?
Well, I think we're doing our best, obviously, and that may be of small consolation to a patient like that who obviously has gone through an absolutely inhuman experience that is difficult to process or understand. The fact of the matter is that COVID-19 demands a disproportionate amount of energy and human resources in a way that very few diseases we've encountered in modern history have posed to us in terms of the challenge. That is really a tragedy. When you talk about cancer care, you talk about surgeries and other things that absolutely have been compromised because of this and because of the human resource shortage. So the short answer is it's not sustainable. The long answer is we have to be very careful about how we're going to mitigate risk further over these next few weeks to allow people just like that woman to receive the care that she needs for something that's completely unrelated to COVID-19. This pandemic obviously has dominated our experience over the last few years, but of course there's a mental health crisis. Of course there are innumerable health crises that have coexisted and existed before this pandemic. And the sooner we do what we can to support nurses, to support every healthcare resource, and to do things within schools and other institutional environments to make them safer and allow vaccination coverage to be what it should, the sooner we're going to be able to get back to helping people who deserve care, whether it's COVID related or not. And I think we're a ways away from that right now.
Catherine, the ONA tweeted the Premier refused to meet with you, but then within the last hour, that was reversed. What are you going to say to the Premier when this meeting does take place?
Well, I'm going to say to him, number one, our members, they're burnt out, they're at their breaking point, they're exhausted, they're demoralized, they're fed up. They have been sacrificed to the healthcare system. And I heard the word abuse being used, and I do firmly believe that term is correct. Our nurses have been abused. I don't know if you remember a few weeks ago hearing about Code Orange, where instead they call a Code Orange when they need mass staff. And that is for a special purpose, not be a surprise emergency, not because they cannot staff a facility. So that is inappropriate. There are healthcare dollars there. I'm going to tell him he needs to repeal Bill 124, 100%. And it is, and you've heard it, about healthcare being a female-dominated profession. And there are billions of dollars, taxpayer dollars, that were earmarked for exactly COVID that have not gone used. He can use that money and do what he needs to do. When we talk about the system breaking, we have experienced, seasoned, registered nurses that have retired through all this. And then we have new graduates that are leaving the profession because it's overwhelming. I've asked the government to invest in our nursing, invest in our profession, invest in our community, and put dollars behind that and bring back the late career initiative and bring those seasoned nurses back into the facilities to help our new graduates, to help our students, because they are tomorrow's healthcare system. That is money well spent. They cannot expect the nurses that are working now in hospitals that have a 1 to 30 patient ratio. Can you believe that, a 1 to 12 patient ratio? And then say, hey, can you help out with the students and teach them their clinical experience? Or can you help orientate our new hires? That's not how it works. We need to put money behind it. There is money out there, billions of dollars. When you sit down and try and add it up, I tried to add it up just before this, and I was coming at $20+ billion. Why aren't we investing that back into healthcare? Not paying down Ontario debt at this time. We need to take care of healthcare in our public funded system. And I so appreciate everybody in healthcare, everybody in the front line, but nurses are the backbone of healthcare. And if you don't have nurses, who's going to take care of the patients that are lying in those beds? Like, we're all a team together. It's time that the government is going to step up and do something during this pandemic. And, they'll say that, they're going to blame previous governments, but let's be honest here. This shortage is 20 years in the making. The government after government just ignored it because it's the priciest piece of our budget. They've allowed thousands of nurses to be cut, and even during the pandemic, they allowed nurses to be cut. I don't know how that could happen, but as a Canadian, I was always proud of my healthcare system, and I can't say that so much now. And I would think if you ask the people of Ontario, they're more than happy to invest in the public healthcare system and invest in our nurses and invest in our future.
On the situation in Orangeville that unfolded over the weekend and continues, we did invite a member from Headwaters to join us live. They declined, suggesting this is a province-wide conversation. But we have a statement issued today by their president and CEO, Kim Delahunt. And Charlene, I'd like you to respond to this. They say, to be clear, only trained healthcare professionals provide patient care at Headwaters Healthcare Centre, regardless of external or internal circumstances. Some non-clinical staff may perform duties outside of their usual scope of work occasionally when necessary, but rest assured that these do not include caring for patients. In response to a baseless claim made by the SEIU, at no time have non-clinical staff been asked to, nor have they carried out any patient care duties. Charlene, should potential patients be rest assured by this?
Well, that the non-clinical staff doing clinical work is not what was reported over the weekend. What they need to be concerned about is that the government, the Ford government, has stopped listening to those frontline workers. And it's my job to be the voice for the frontline workers. What we need now is for this executive to be as concerned as I am and the public is about the staffing shortages. And when you're asking people to do jobs that they not familiar with, puts added burden on those who are orientating them or telling them what to do. Again, we need the public to call on their MPPs and Premier Ford to act now and deal with this crisis there. It's my job to ring the alarm bells, which is exactly what I did over the weekend, and there remains a staffing crisis in the province and at the Blue Water Healthcare facility as we speak tonight.
And as the crisis continues, we will continue to discuss this. We appreciate all of you making time tonight for us. Charlene Stewart, Catherine Hoy, and Dr. Abdu Sharkawi. Thank you. Thanks.